Cary Yurkiw here. Thanks for joining me today for this live webinar called Joint Journey, a holistic approach to joint health and fitness. And it's based on my book on Amazon. And this book is called Joint Journey. It was just published a couple of weeks ago, and the audiobook is now out. And yeah, I'm getting some good feedback on it. It talks about weight loss. It talks about joint health, relieving the pain in joints, relieving arthritis, healing the tissues in the joints. So we're going to be talking about that today. In particular, we'll be talking about physical fitness and joint health. We'll be talking about nutrition. And so I hope you can stay for this webinar. And if you're live with me, you can ask questions in the chat. I'll be paying attention to the chat as we go through the webinar. If not, if you catch the recording, you can always ask questions in the comments. Please do like this video and follow me here on YouTube for future videos like this one. So I'm just going to switch over now to my presentation. Just bear with me here. And again, today's topic is going to be a holistic approach to joint health and fitness, and it's going to be based on the book that I just showed you. And thanks again for joining me for this webinar. I cover many different topics from the book, and I try to break it down into specific webinars. So today we want to focus a little bit more on the physical fitness side of things. And so our agenda today is an overview of the Joint Journey book, the synergy between lifestyle changes and joint pain relief, sustainable weight loss strategies, evidence-based approaches for joint health, and an interactive discussion where you can ask questions and I'll provide answers to those questions. So let's now take a look at lifestyle changes for joint health. So if you are thinking about making some lifestyle changes for your joint health, what are some things that you can do to make those changes? Well, you can set some goals, and you can set some goals for the new year so that you can incorporate regular physical activity into your routine. Now, sometimes that's difficult to do when you're in a lot of pain. So going to see a chiropractor, getting assessed, getting treatment for your specific condition is important. So chiropractic can provide relief for the joints, increase the range of motion and the flexibility. And then the next step is to start to make some changes at home, and changes like your nutrition. So balancing your nutrition so that you can fuel your body with a diet rich in anti-inflammatory foods. So a lot of vegetables can be anti-inflammatory, and some of them can be pro-inflammatory too. So we really want to eat foods like avocados that can be very good as an anti-inflammatory food. I recommend protein, and some people like certain types of protein, like if you can eat chicken, or you can eat some meat, or you can eat nuts or tofu. So depending on fish is an excellent source of protein and provides a lot of good fat as well. So making some changes to your diet that are more anti-inflammatory and reducing some of the pro-inflammatory foods, ones that have a lot of preservatives in them, foods that have artificial colors or sweeteners, preservatives like nitrates. You want to reduce those because that'll reduce your inflammation. And if you eat foods that are more natural and whole, they can provide the protein and the nutrients you need to rebuild the joints. Stress management is important too, because if you have high stress levels, it releases cortisol into the blood, and cortisol is pro-inflammatory. So people who have a lot of stress tend to have more inflammation, and their joints ache, and their nervous system is more sensitive to any changes, like changes in the environment, hot or cold, changes like activity levels. So to alleviate symptoms for your joints, you want to reduce your stress and manage stress effectively. There's nothing wrong with a stressor that is short term. So if you have some stress and it's short term, no problem. But if the stress is a long-term stressor and it is there on a regular basis, then you definitely want to change the stress levels, and you want to manage that stress more effectively. Sorry guys, I just realized that my picture was cutting off some of the slides, so I wanted to move that over. All right, so just going back to the presentation here, and sleep quality. So sleep quality, you want to understand the crucial role that quality sleep plays in joint recovery. Now, something that I tell my patients is if you have pain in your joints, you don't want to sleep on the painful side. So let's say you have shoulder pain on the right side, you want to sleep on your left side. So sleep on the pain-free side. Generally, sleeping on your back is good. Unless you've got a lot of hip pain or upper back pain, it may be better to sleep on the side. And generally, sleeping on your stomach is not a good idea. So you want to get a good night's sleep. In the book, I talk about different things you can do for a good night's sleep, but I find one of the most important points for me is to reduce the temperature in the room 1 to 2 degrees Celsius, 3 to 4 degrees Fahrenheit, and that'll just help you to fall asleep better. So I like to set my room temperature in the high teens, 18, 19 Celsius, which would translate to somewhere in the mid 60s to high 60s in Fahrenheit. And so reducing the temperature in the room, darkening the room, making sure that there's no noises, reducing the screen time before bed, half an hour before bed, you want to shut off your phones or the TV. And, you can listen to a podcast or an audiobook. That's a good way to fall asleep, but I wouldn't be stimulating your brain or your retina too much, because you want your brain to start kicking into that gear where it starts to produce melatonin. And the only way that the brain starts to produce melatonin is if the retina and your eyes don't have a lot of stimulation. So you really want to decrease the stimulation and allow the body to start producing melatonin, a natural sleep aid. For sustainable weight loss strategies, some things that you want to consider are mindful eating. So embrace a conscious approach to food consumption. So you really want to think about the foods you're eating. One of the biggest things that I've learned is just eating when you're hungry. You don't have to eat when you wake up in the morning. You don't have to eat 3 square meals a day. But listen to your body, and when you're hungry, eat some food. And I usually tell people to eat protein first. So eating protein will satisfy the brain, and one of the ways it does that is some enzymes are released in the mouth, in the saliva, that starts to make you feel fuller. The satiety center in the brain starts to be stimulated by some of the proteins being eaten and the enzymes that are released. And these enzymes kind of trigger that satiety center in the brain. So basically eat some protein first, or eat the protein on your plate first, and then you'll start to feel full quicker. And eat slowly, because as your body digests the food, your stomach expands, your intestines expand, and that starts to send signals up to the brain as well. Regular exercise is important, so design a fitness routine that suits your lifestyle. The current guide is for 150 minutes of physical fitness a week. So that translates to maybe 20 minutes a day, roughly. And if you can just get in a workout maybe on your lunch break, at the end of the day in the morning, you can get in 20 minutes very easily. And often I'll do workouts here at the clinic on my lunch break, and I'll use Apple Fitness Plus for that, and it tends to work really well. Sometimes I run to work in the morning. That's great too, especially on the weekend. And that's definitely enough time for me to get that exercise in and a little bit more. So again, 150 minutes of physical activity a week. Nutrient-rich diet, so focus on whole foods for sustainable weight loss. And what I mean by whole foods is you want to eat foods that are in their natural state. Like I talked about avocados earlier, you just want to have a whole food, a whole apple, a whole banana, and rather than a processed form of it. And then you want to address emotional and psychological factors influencing weight management. So sometimes people get cravings because they are stressed. So stress releases that cortisol we talked about earlier, and then you can get sugar cravings. Or when you eat sugar, the body's insulin increases, and it tends to make you want to eat more sugar. So there's kind of a compounding effect, I find, to it, because it's stimulating dopamine in your brain, and because it feels good, you want to eat more of it. So you really want to be careful with how much sugar and carbohydrates you're eating, because number one, you want to make sure you're getting enough nutrition from that food, not just sugar or processed food, processed sugars. And number two, it's lighting up the dopamine center in the brain, and you don't want to kind of activate that addictive center where you're craving more and more sugar. So eating protein, healthy fat is a good way to make your brain kind of feel like you're getting enough nutrition, you're feeling full, or that satiety center is being activated, and you don't feel like you need to eat more food. So again, focusing on protein and healthy fats is a good way to go. As far as anti-inflammatory foods, you want to do a little bit of research on that, and I'll have some webinars coming up on anti-inflammatory, pro-inflammatory foods soon. You want to explore evidence-based supplements for joint support. One of the best ones is turmeric, which has a lot of research behind it. So adding some spice like turmeric to your food, or taking some capsules can really help to reduce inflammation in the body. And you want to take natural supplements as much as possible to reduce inflammation and repair the joints. For posture and movement, you want to understand the impact of posture on joint health. And what I mean by that is, if you're on your phone a lot with your head down, if your desktop setup is not correct, you're going to be twisting your neck, you're going to be slouching. If you're standing on one leg a lot, you're going to be off balance, and that's going to cause joints on one side of the body to get worn out faster than the other side. So we want to minimize the damage to the joints because of poor posture. And then you want to learn about modern interventions for persistent joint issues. Some of those include supports like postural supports. Some of those include other therapies that can help with the joints. Definitely increasing the range of motion, flexibility of the joints, allows better synovial fluid flow through the joints. It kind of helps the cartilage to function better. It works with the nutrients being supplied to the joint, taking away waste products. So we definitely want to get flexibility back in the joints as soon as possible to keep the joints healthy. And that's where chiropractic can be very beneficial, because doing adjustments to the joints increases the range of motion and improves the alignment of the joints as well. Now, I can ask any questions you might have, so I'll check over here in the chat. But certainly I want to answer some of these commonly asked questions, like why is a balanced lifestyle essential for joint health? And a balanced lifestyle is crucial because it incorporates regular physical activity, a diet rich in anti-inflammatory foods, stress management techniques, and quality sleep. These are elements that collectively contribute to reducing inflammation, supporting joint function, and promoting overall well-being. So that's a question that I get often. And how can mindful eating contribute to sustainable weight loss? Mindful eating involves being present and conscious during meals, which can prevent overeating and promote a healthier relationship with food. By savoring each bite, recognizing hunger cues, and making intentional food choices, individuals can create sustainable habits that support long-term weight management. So really having that healthy relationship with food, understanding the purpose of food, eating foods like proteins and fats first in the meal can really help you to manage your nutrition, manage your energy effectively. What are some evidence-based strategies for alleviating joint discomfort? Well, some of the evidence-based strategies are chiropractic care, because it helps to realign the joints, improves the function of the joints, and promotes healthy joint alignment and function. So there's going to be better synovial fluid flow through the joints. There's going to be better structure of the ligaments and muscles and tendons around the joints. We also want to recommend exercises that people can do for flexibility, like yoga, like core strengthening, that can really help the joints to function better. How does stress impact joint health, and what are some effective stress management techniques? Well, stress can contribute to inflammation and exacerbate joint issues. Effective stress management techniques include mindfulness practices like deep breathing exercises, regular physical activity, and creating a supportive environment. These techniques not only alleviate stress, but also positively impact joint health. And one of my favorites is meditation. Just spending some time each day to put aside for meditation, to be mindful, to do some breathing exercises. Very helpful for just keeping you centered, keeping the brain kind of in a calm state, giving you lots of elasticity or range to deal with day-to-day and minute-to-minute hourly activities. Can you provide examples of nutrient-rich foods that support sustainable weight loss? Well, some of the nutrient-rich foods that I recommend are vegetables and fruits, whole grains, lean proteins, healthy fats. These foods provide essential nutrients, promoting satiety, feeling full, and contribute to overall health. Crafting a diet with these elements supports sustainable weight loss by nourishing the body and reducing the likelihood of nutrient deficiencies, which can create cravings. You might get cravings because you're deficient in a certain nutrient. And I find people tend to overeat when they're deficient in certain nutrients, so they're craving getting that nutrient, but eating way too much food to try and get that nutrient extracted from the food, if that makes sense. So our contact info here at Tut Street Family Chiropractic is we're at 2755 Tut Street in Kelowna, unit 406, and the phone number is 250-486-0062, and our website is tutstreetfamilychiropractic.com. The services we offer here in the clinic are chiropractic, shockwave, laser, orthotics, and custom-made shoes, webinars and masterclasses like this one, and ones that are a little bit more in-depth and instructional. health coaching for people that need that extra help, and products that support health, like electrolytes, like protein supplements, like turmeric and curcumin to help with anti-inflammatory effects. If you're interested in getting my book on Amazon, it looks like this: Joint Journey, Lifestyle Changes for Lasting Weight Loss and Joint Pain Relief. And it is in paperback, it is in ebook, Kindle, it is in hardcover. It's the first time I've done hardcover. I'm awaiting my first copy of a hardcover book. And then it's just went live on Audible as well, the audiobook version, and that's available now too. And I do narrate the book, so you're going to hear my voice in the book and read through the chapters. You can also go to our website to find out more. We're just developing the page dedicated to the webinars, the Joint Journey, so that should be live in the new year. Our next webinar is in a week, and it's called Transforming Your Joint Health, a Healthy Approach to the New Year. So if you're looking to set some goals for 2024, this would be a good webinar for you, because I'm going to talk about how you can set goals, what SMART goals are, and what are some important goals to focus on for joint health and weight loss. So we'll be talking about posture, we'll be talking about nutrition, we'll be talking about lifestyle at that webinar as well. You can get a ticket by going over to Eventbrite, and a good way to see all of the services that I talked about today and offer is to go to our Linktree account, and I'll put a link in the show notes, but it's basically linktree.com/Dr. Cary Yurkiw, and you'll be able to see all the webinars that we have to offer, the YouTube channel, our social media. If you want to book an appointment in the clinic, you can do that. So you're going to have all those options at Dr. Cary Yurkiw at Linktree. So linktree.com/Dr. Cary Yurkiw. I want to thank you for joining me today. I really enjoy doing these webinars. I find each time, there's a little bit more information, a little more specific information from the book that I'm able to do. And one webinar is building off the previous ones. So please do follow me here on YouTube, subscribe to my channel, like this video, as well as on social media. Follow on Facebook and Instagram, on Twitter or X, it's called now, and TikTok. So thanks for joining me today. I look forward to seeing you guys next week and talking to you tomorrow.